So Dr. Jen already talked about the positive and negative as well as cognitive deficits. I want to reiterate that almost all of the drugs that we talk about today, all of the antipsychotic drugs, they can help the positive symptoms. And so both the first generation or typical as well as the second generation or the atypical antipsychotics, they all can help positive symptoms. Only the newer ones, the second generation antipsychotics, some of them can help the negative symptoms, okay? The first generation, they do not typically help the negative symptoms. Some of the newer second generation ones can help the negative symptoms. And none of them can directly help the cognitive deficits, okay? We cannot help them. Now, sometimes after taking drugs, the patient's cognitive functions seem to improve. That likely is because of indirectly, let's say if the patient decrease their likelihood of hallucination, then they can focus more, then their cognitive functions seem to improve, right? So, but the drugs themselves are believed that they do not directly help to improve the cognitive function. So by looking at that, you can immediately also imagine that, as Dr. Jen mentioned, that in schizophrenia, there is a massive change in the brain. A lot of areas that in the brain that Dr. Jen even showed you the more advanced stage, then practically the whole brain is changing, shrinking. Shrinking means that they are decreased in neurons as well as axons, right? So none of the drugs that we are talking about can reverse that process, not even slowing it down. All we are talking about is trying to managing the symptoms, okay? Because we believe that there is a dopamine receptor abnormality and also maybe serotonin receptor too. So based on that, we are not curing or treating schizophrenia. We are simply managing the symptoms. This is very similar to epilepsy, right? We are not treating or curing epilepsy. We are simply managing the seizures. So this is the same concept. Dr. Jen already talked about the dopamine hypothesis as initially it's because of the amphetamine study that people realize that if you give amphetamine, it can actually increase the dopamine concentration in some of the brain regions. And that is related to some behavior that looks like schizophrenia, psychosis. So then also when chlorpromazine first came out, people said that, oh, it can actually block the dopamine receptors. So hence people keep working on it. And so there are evidence that the dopamine D2 receptors, there are 5 major subtypes of dopamine receptors, D1, 2, 3, 4, 5, okay? And D2 is the main receptor we believe that is involved in antipsychosis drug.